Welcome to Medical Officer Training Module. This module will guide you to manage anxiety disorder in primary healthcare. Globally, it was reported that about 272 million people had an anxiety disorder at any point of time in 2010. Adults aged 20 to 64 seem to have the highest prevalence. In Malaysia, it was reported that about 2 in 100 adults aged 16 and above had anxiety disorder. Many of the anxiety disorder develop in childhood and tend to persist if left untreated, and most frequently female more than male with ratio of 2 in 1. Etiology of anxiety disorder can be biological factors, which include genetic factor, biochemical factor, and neuroimaging and brain metabolism. It can be also caused by cognitive, psychological, and developmental factors. Risk factor of anxiety disorder including ongoing stress in life, persistent worry about own health condition, work, finance, and family conflicts. Second, personality. Perfectionists, high achievers, sensitive, and shy personality, all people with low self-esteem are thought to be more likely to develop anxiety. Third, pregnancy and childbirth. Fourth, trauma. Example, stressful event which cause significant distress such as witnessing death or accident, earthquakes, severe storm, fires, or becoming a victim of sexual abuse and violence can contribute to anxiety, and mass tragedy with the example COVID-19 outbreak. Anxiety disorder that share features of excessive fear and anxiety and related behavioral disturbance. Fear is an emotion response to real or perceived imminent threat. Anxiety, anticipation of future threat, differ from one another in the types of object or situation that induce fear, anxiety, or avoidance behavior and the associated cognitive ideation can be differentiated by close examination of types of situation that are feared or avoided and the content of associated thought or belief. Key feature of general anxiety disorder, which persistent and excessive anxiety and worry about various domains, and it is difficult to control. 4. Agoraphobia, which fearful and anxious in more than one situation, example, using public transportation, being in open or enclosed space, standing in line or being in a crowd, or outside of the home alone in other situations, and the thought that escape might be difficult or help might not be available, and it always induces fear or anxiety. For substance medication-induced anxiety disorder involve anxiety due to substance intoxication or withdrawal or to a medication treatment. Consistent failure to speak in social situations in which there is an expectation to speak even though the individual speaks in other situations is the key feature for selective mutism. Whilst for the specific phobia, there is fearful, anxious about or avoidance of objects or situations. For social anxiety disorder or social phobia, there is fearful of being scrutinized, embarrassed, humiliated, rejected, or offended. Panic disorder characterized by abrupt surge of intense fear or intense discomfort that reach a peak within minutes, accompanied by physical and or cognitive symptoms. It is common in patients with anxiety disorder. For separation anxiety disorder, fearful or anxious about separation from attachment figures to a degree that is inappropriate, persistent fear or anxiety about harm, an event that could lead to loss or separation and reluctance to go away from attachment figures, and it may be presented with numbness and physical symptoms of distress. It usually develops in childhood but can be expressed throughout adulthood. The last type of anxiety disorder is anxiety disorder due to another medical condition. DSM-5 diagnostic criteria for generalized anxiety disorder. First, excessive anxiety and worry occurring more days than not for at least 6 months about a number of events or activities, such as work or school performance. Second, the individual find it difficult to control the worry. Third, the anxiety and worry are associated with 3 or more of the following 6 symptoms, with at least some symptom having been present for more days than not for the past 6 months. The general anxiety symptoms are restlessness or feeling keyed up or on edge, being easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, and sleep disturbance. The fourth DSM-5 diagnostic criteria for generalized anxiety disorder are the anxiety, worry, physical symptom cause clinically significant distress, impairment in social, occupational, or other important areas of functioning. Fifth, disturbance is not attributable to the physiological effect of a substance, example, drug abuse or a medication, or another medical condition. Last one is the disturbance is not better explained by another medical disorder. We are using GAD2 and GAD7 as our screening tool for generalized anxiety disorder, which show in the chart with high sensitivity and high specificity. GAD2 consists of 2 questions. First, feeling nervous, anxious, or on edge. Second, not being able to stop or control worrying. This symptom must be present for the past 2 weeks. The score 0 to 2 consider no risk. Score more than 3 require further screening by using GAD7. There are 7 questions for GAD7. First, feeling nervous, anxious, or on edge. Second, not being able to stop or control worrying. Third, worrying too much about different things. Fourth, having trouble relaxing. Fifth, being so restless that it is so hard to sit still. Sixth, being easily annoyed or irritable. 7. Feeling afraid as something awful might happen. Answer to 0 means there is not at all for the past 2 weeks. Answer to 1 means several days. 2. More than half of the week. And 3. Nearly every day for the past 2 weeks. This is the summary chart for GAD7. Score 0 to 4 is normal, 5 to 9 mild, 10 to 14 moderate, and more than 15 is severe. The main objective to treat general anxiety disorder is to reduce symptoms of anxiety and thereby improve functioning. Individuals with mild anxiety disorder that does not interfere with their daily functioning may reasonably elect to forego treatment initially. Typically follow up every 3 months to see if worsening symptoms warrant treatment, and it needs shared decision with patient. The treatment option for generalized anxiety disorder can be non-pharmacology and pharmacology. For non-pharmacotherapy, it can be CBT, cognitive behavior therapy, for 12 to 15 weekly section, educate patient about misconception on bodily sensation to lessen fear response, problem-solving therapy, and relaxation therapy. Various pharmacotherapy and CBT are effective treatment for GAD. Combination for pharmacotherapy and CBT may be more beneficial. Choice of treatment is individualized and one of shared decision making. For the pharmacotherapy treatment, preferred choice are selective serotonin reuptake inhibitors, SSRI, and serotonin norepinephrine reuptake inhibitors, SNRI. Selection among SSRI is based on the medication side effects profile, drug-drug interaction, and/or patient treatment history or patient preference. In clinical trials, SSRI example paroxetine, sertraline, citalopram, and escitalopram have been found to be more effective in anxiety reduction. If effective, pharmacotherapy should be continued for at least 12 months. If the patient experiences a relapse following termination of an effective medication, the length of treatment can be extended. After 2 relapses when tapering off the medication, ongoing maintenance therapy is suggested. In this slide, show the side effect of the medication for selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors. The common medication that are available at our setting are fluvoxamine, sertraline, and escitalopram. Now, let us discuss a case. A 35-year-old doctor pursuing her specialty presented with excessive worrying regarding her thesis write-up and due assignment. She finds it difficult to control the worry and is associated with difficulty in concentrating at work for the past 7 months. She had also experienced easily fatigue and difficulty in falling asleep. These symptoms are present on most days of the week. She has no underlying medical condition and unremarkable on clinical examination. Question number 1. What is the next management step? Question number 2. What is the diagnosis? Question number 3. What is the most appropriate management for this patient? The answer for the first question, the next management step. We need to perform a mental state examination, screening, and diagnostic tool with GAD-7. So, the diagnosis for this patient is generalized anxiety disorder because she fulfilled the DSM-5 criteria for excessive worrying more than 6 months, difficult to control the worrying, and has 3 of the following 6 symptoms. The last, management. We need to have a shared decision with the patient in initiation of SSRI with cognitive behavior therapy. With that, thank you for your attention.